WGN Investigates gets the first look at a new program by the Cook County Sheriff's Department. It's meant to help control the increase in 911 calls associated with people dealing with mental health issues.
The new tool is a device many of you use every day. WGN's Lourdes Duarte has a rundown of the program that's rolling out right now.
Police departments across the country have talked about the need for more mental health professionals out in the field. Cook County says calls associated with mental health issues have increased almost 30% since last year, and they expect that trend to continue.
Get on the ground. Put your hands behind your back. Behind your back.
Yes,
Don't
sir.
move.
It's scenes like this one last year in Rochester, New York, that have led some to question how police can and do respond to mental health emergencies.
Are you Daniel?
Yes, sir.
Daniel Prude?
Chicagoan Daniel Prude was reportedly experiencing a mental breakdown, high on PCP and spitting at officers when this hood was placed over his head.
Drag me, kill me. And Jesus gonna let me. My mama flew over that grave, man.
But what began with a family's call for help ended in tragedy when Prude later died of suffocation.
I placed a phone call for my brother to get help, not for my brother to get lynched.
Although Prude's case is extreme, law enforcement in Chicago and Cook County deal with mental health calls every day.
If there's one consistent note that I hear everywhere around the country is that people would like to have law enforcement not be the first responder to houses when there's a mental health issue.
But the sheriff says that isn't always possible, given how volatile the calls can often be.
Can't call a mental health provider and say, listen, can you send someone out, a 2-hour drive and have them come by here in the next 5 minutes? No.
But he says his office may have come up with the next best thing.
It's literally putting a mental health professional in every squad car.
Well, not technically, but here's how it works. Under the sheriff's new program launched this year, officers are equipped with tablets. Here's a demonstration.
Treatment response team, this is Brittany.
Hi, Brittany. I have an individual that would like to speak to you. I'm going to pass you to them.
The officer on scene hands the iPad to the person in need of help. Ellie Montgomery, the treatment response team leader, has stepped in as a person in need.
What's going on today?
I don't really know what to do.
Do you feel safe at home right now?
So in certain mental health emergencies, they can instantly connect a person in need with one of the department's licensed clinicians.
Everyone that we work with in the community knows what a cell phone is, and they're used to FaceTime. So the moment they have that device and they see non-officer, a clinician, a mental health professional who can talk to them through this device, instantly you start seeing them calm down.
She acknowledges that it may not be enough in severe situations like the one involving Prude, but it is showing promise in less extreme cases, which make up a majority of the 911 mental health calls.
It probably would have got violent.
Take the case of 19-year-old Jordan, seen here speaking to a team member on a tablet after sheriff's police responded to a disturbance at her family's home.
I can't talk to just anyone. I can't call people my friends because of what they do to me. I'm sick of being used. And
not only did the incident end peacefully for everyone involved, even the officers, no one was charged criminally, and Jordan got the help she needed.
Sometimes the police can be intimidating as it is, especially someone who has been encountered with them before and it's never been a good experience. So it gives everyone a chance to feel like they're safe and they're being heard.
So we find a lot of people that are in this neighborhood that are suffering from addiction.
If you call, we'll help.
We first showed you Montgomery's team in action last year, canvassing communities where drug use is rampant in response to the opioid crisis.
You give me a call and I'm going to help you.
Okay.
All right?
They're taking a similar proactive approach with mental health with a crew of clinicians on call.
A lot of times the calls are unpredictable, so they come at all hours of the day.
Sometimes even if they don't accept help at that moment, they'll call us back.
What if they break it? What if they do
When the program first launched, veteran officers had doubts.
I'm not sure this is going to work.
But the sergeant's skepticism softened after a recent mental health call.
I have a person in crisis.
After FaceTiming with a team member, the man who was erratic and threatening suicide,
he walked to the ambulance without an issue.
The sheriff started with 35 tablets. He plans to double that number and expand the program to include other police departments countywide.
The feedback is overwhelmingly positive, both from the citizens whose houses we come to because they're in this horrible situation, and from our officers who sit there and say, thank God you're there.
The Chicago Police Department unveiled its own program. It rolled out this month in 13 Chicago neighborhoods. It pairs certified mental health professionals with police. By the way, departments all across the country are trying different things for the same problem. In Boston, EMTs and mental health workers will respond without police to 911 calls involving mental health issues that don't put public safety at risk. I'm Lourdes Duarte, WGN Investigates.